Manila pulses with energy, a city where history and modernity collide in a vibrant, sometimes chaotic dance. From the centuries-old walls of Intramuros to the gleaming towers of Makati, every corner tells a story of resilience and reinvention. The streets are alive with commerce, laughter, and the hum of activity that defines one of Southeast Asia's great megacities. Vendors call out their wares, jeepneys weave through traffic, and the city's heartbeat is felt in every crowded market and bustling avenue. This dynamism is a source of pride and economic power, drawing people from across the archipelago and beyond. Every day, new faces arrive, chasing dreams and opportunities, adding to the city's ever-evolving tapestry. But today, a different cloud hangs over the city, a persistent, toxic haze that refuses to lift, casting a shadow over daily life. Smog now regularly shrouds the skyline, obscuring the very landmarks that symbolize Manila's progress. Once proud silhouettes fade into the gray, reminders of both achievement and the cost of unchecked growth. The air, once scented with sea salt and street food, now carries the acrid taste of pollution. Residents don masks, not just for health, but as a daily shield against the city's invisible threat. The paradox: Manila's growth is choking the city with its own success. Prosperity and progress have come at a steep price, as traffic jams and construction sites pump more pollutants into the air. Years of rapid, often unregulated development have led to this crisis. The city's expansion, once a symbol of hope, now threatens the health of its people and the environment. The consequences are now impossible to ignore, visible in the sky, felt in every breath, and measured by alarming air quality data. Children and the elderly are especially vulnerable, and hospitals see the toll in rising respiratory illnesses. The challenge isn't choosing between a healthy economy and a healthy environment, it's realizing we can't have one without the other. Sustainable growth is no longer a luxury, but a necessity for Manila's future. Manila's air crisis is a local story with global implications, a test case for the future of urban living. Cities worldwide are watching, learning, and facing similar crossroads. The path the city chooses now will offer lessons for us all. In the struggle between progress and preservation, Manila stands as both a warning and a beacon of hope for cities everywhere. Data is our first tool in understanding Manila's air crisis, the most critical metric: PM 2.5. Fine particles that penetrate deep into the lungs. The World Health Organization's safe annual average is 5 micrograms per cubic meter. In 2025, Manila's daily levels are 5 to 10 times higher, often exceeding 35 micrograms per cubic meter. This places Manila among the world's most polluted capitals. On many days, the air quality index surges into the unhealthy or very unhealthy range. Simply breathing outdoors poses a tangible health risk, like passively smoking several cigarettes a day. During rush hours or stagnant weather, PM 2.5 can spike to hazardous levels, forcing residents indoors. Schools cancel outdoor activities, hospitals see more emergency visits. These numbers aren't just statistics, they measure the daily burden on Manila's health and vitality. The crisis is urgent, and the data makes it impossible to ignore. To solve Manila's air crisis, we must understand its sources. The biggest culprit: millions of vehicles, many old and poorly maintained, burning low-quality diesel. Iconic jeepneys and endless traffic jams compound the problem, with idling engines spewing pollutants. Construction is another major source. Dust from demolition, excavation, and heavy trucks fills the air. Without proper dust control, these sites bleed pollution into neighborhoods. Industrial emissions add another layer, with factories and power plants releasing harmful chemicals. Illegal burning of waste, especially in poorer communities, releases toxic substances into the atmosphere. Manila's geography, surrounded by mountains and sea, traps pollutants, especially during low wind and temperature inversions. The result: a perfect storm for smog, turning the metropolis into an inescapable gas chamber. Understanding these sources is the first step toward real solutions. The numbers on air quality charts aren't just statistics, they translate into real human suffering, affecting lives every single day. Manila's polluted air is fueling a public health emergency. Respiratory illnesses are surging at an alarming rate, impacting thousands. Hospitals across the city report more cases of asthma, bronchitis, and COPD than ever before. For many residents, coughing fits and breathlessness have become a daily routine, a constant reminder of the air they breathe. Children are especially vulnerable. Their developing lungs are stunted by the toxic air, and they miss out on school and play due to frequent illness, falling behind in their studies and social lives. The elderly face life-threatening risks. For them, even a short walk outside can be dangerous. On days when the air is especially bad, many seniors become prisoners in their own homes, isolated from the world outside. The health impacts go far beyond the lungs. Long-term exposure increases the risks of heart disease, cancer, and even cognitive decline, affecting memory and mental sharpness. Pregnant women face higher risks of premature birth and low birth weight babies, putting the next generation at risk before they're even born. The city's air is robbing residents of health, mobility, and quality of life, making simple activities a challenge for everyone. The crisis is personal, affecting every family and every generation, leaving no one untouched by its consequences. The strain on Manila's healthcare system is immense and growing, stretching resources and exhausting medical workers. This is not a distant environmental issue. It's a direct assault on the city's future, threatening the well-being of all who call Manila home. The damage is systemic and insidious, creeping into every aspect of daily life and community health. The time to act is now, before the crisis deepens and more lives are put at risk. The Philippine Clean Air Act of 1999 was a landmark law, setting emission standards and banning incineration. The government has tried to modernize public transport, aiming to replace old jeepneys with cleaner models, but enforcement is weak. Corruption and lack of resources let polluting vehicles and industries slip through the cracks. The PUV modernization program faces resistance from transport groups, slowing progress. Efforts are fragmented, lacking a cohesive metropolitan-wide strategy. Air pollution ignores city boundaries. Solutions must be coordinated across all of Metro Manila. Piecemeal projects and road building often worsen congestion and pollution. The real needs shift from managing traffic to managing mobility, prioritizing people over cars. Despite good laws, the air is getting worse, not better. Rhetoric and pilot projects aren't enough. Robust enforcement and funding are essential. The challenge is to move from words to action, holding polluters accountable at every level. Manila's struggle isn't unique. London, Los Angeles, and Beijing have all faced air crises. These cities turned the tide with strong laws, strict enforcement, and massive investment in clean transit and energy. Beijing's aggressive action plan, shutting coal plants, limiting cars, investing in public transport, shows rapid progress is possible. Manila mirrors other megacities like Jakarta and Lagos, all grappling with explosive growth and pollution. The lesson cities can choose between pollution-fueled growth or sustainable development. The roadmap is clear. Regulations, clean transit, and data-driven policies work. Manila can learn from global successes and failures to chart its own path. The cost of Manila's air pollution goes far beyond hospital visits. Lost productivity is a direct hit. Sick workers and parents caring for ill children slow the economy. Even those not visibly sick may suffer reduced energy and focus, hurting innovation. Healthcare costs for pollution, linked diseases, drain public and private resources. Tourism and investment suffer as Manila's reputation for poor air quality grows. Multinational companies may avoid the city, limiting growth and opportunity. Pollution damages infrastructure and agriculture, with hidden but significant financial consequences. The economic toll is a hidden tax on everyone. Inaction is far more expensive than solutions. Clean air isn't just a health issue, it's sound economic policy. The way forward is clear. Manila needs a multi-pronged approach. Transforming transportation is key. Invest in electrified public transit, expand train lines, and build safe bike lanes. Accelerate the shift to electric vehicles with incentives and strict regulations. Enforce incorruptible emission standards for remaining combustion engines. Require industries to use best available pollution controls with real-time public monitoring. Crack down on construction dust and ban open waste burning, expanding formal waste management. Increase green spaces, parks, rooftop gardens, and green walls to filter air and cool the city. Urban planning should promote walkable, mixed-use communities to cut commutes. Integrate these innovations to make Manila more resilient and livable. The solutions exist. What's needed is the will to implement them. The causes of Manila's air pollution are well known: vehicle emissions, industrial smoke, and unchecked urban growth. The solutions, too, are within our reach, but the real question is whether we have the collective will to act, to move beyond talk and into meaningful change. This is a moment of truth for Manila, a crossroads that will define the city's future for generations. Continuing on the current path means more chronic illness, lost potential for our youth, and a diminished quality of life for everyone, from children to the elderly. Bold, decisive leadership is needed, leadership that is unafraid to make tough decisions for the greater good. No more incrementalism or unenforced policies that only look good on paper but fail in practice. Government must commit to a comprehensive clean air plan, backed by real investment, strict enforcement, and the courage to make tough choices. The private sector must invest in cleaner technologies and sustainable practices, not just for profit, but for the health of the city. Businesses and communities must become true partners in the solution, working hand in hand for a cleaner tomorrow. A healthy population and clean environment are the foundation of a thriving economy. Citizens must demand change through advocacy, voting, and daily choices. Use public transport, conserve energy, support sustainable businesses, and educate others about the importance of clean air. The journey to reclaim Manila's sky will be long and challenging, but it must begin now. With shared commitment and persistent effort, the city can build a healthier, more breathable future for all its residents. The time to act is today. Every moment counts, and every action matters. Manila's sky can be blue again, if we choose it, together, with hope and determination.